Welcome to our video on anesthetic considerations in critically ill patients. As healthcare providers, it's important to understand the unique challenges that come with caring for critically ill patients in the ICU, especially when it comes to administering anesthesia. In this video, we'll be discussing the various types of anesthesia that may be used in critically ill patients, as well as some of the important considerations that must be taken into account when caring for these patients. Segment 1. Types of anesthesia for critically ill patients. When it comes to anesthesia in critically ill patients, there are a few different options that may be considered, depending on the patient's condition and the type of procedure being performed. General anesthesia is often used for critically ill patients who are undergoing major surgical procedures, as it induces a deep sleep, allowing the patient to be unconscious during the procedure. Regional anesthesia is another option, which numbs a specific area of the body. This can be used for procedures that only require a specific area of the body to be numb. Examples include spinal, epidural, and peripheral nerve blocks. Local anesthesia, in which medication is given by injection directly into the area that will be numb during the procedure, is also a viable option for critically ill patients. Segment 2. Anesthetic considerations in critically ill patients. When caring for critically ill patients, there are several important considerations to keep in mind when it comes to anesthesia. These include the patient's overall health, the type of procedure being performed, and any underlying medical conditions or complications that may arise during the procedure. One of the most important considerations when caring for critically ill patients is the patient's overall health. This includes assessing the patient's vital signs and ensuring that they are stable before proceeding with the procedure. It's also important to consider any underlying medical conditions or complications that may arise during the procedure, such as respiratory or cardiac issues. Another important consideration is the type of procedure being performed. For example, a patient who is critically ill and undergoing a major surgical procedure will require a different type of anesthesia than a patient who is critically ill and undergoing a minor procedure. Another important factor to consider is the patient's airway. In critically ill patients, the airway can be compromised, making it more difficult to maintain proper ventilation and oxygenation. Anesthesiologists must be prepared to manage the airway in a variety of different ways, such as intubation or the use of non-invasive ventilation. Lastly, it's important to consider the use of sedation and analgesia in critically ill patients. Due to the nature of their illness, these patients may be in pain or discomfort, so it's important to keep them comfortable and pain-free throughout the procedure. Overall, when caring for critically ill patients, anesthesiologists must take into account a variety of different factors in order to ensure the safety and comfort of the patient during the procedure. Segment 3. When it comes to anesthetic considerations in critically ill patients, there are a few key things to keep in mind. One of the most important things is to consider the patient's underlying medical conditions, as well as any recent changes in their health status. This is important because certain medical conditions, such as heart or lung disease, can make the administration of anesthesia more complex and can increase the risk of complications. Another important consideration is the patient's age. Elderly patients may be more susceptible to certain complications, such as delirium or post-operative cognitive dysfunction, and may require different anesthetic techniques or medications. It's also important to consider the type of procedure being performed and the patient's level of consciousness. For example, if a patient is in a coma or has a severe brain injury, they may not be able to communicate their needs or tolerate certain types of anesthesia. In these cases, the anesthesiologist may need to use special techniques or equipment to ensure the patient's safety and comfort. In addition to these considerations, it's also important to be aware of the patient's allergies or sensitivities to medications. It's important to know about any allergies or sensitivities to medications that the patient may have and to take them into account when selecting the appropriate anesthetic. Overall, the administration of anesthesia in critically ill patients requires a high level of expertise and careful planning. By taking into account the patient's underlying medical conditions, recent changes in their health status, age, and other factors, the anesthesiologist can develop an anesthetic plan that is tailored to meet the specific needs of the patient, in order to ensure their safety and comfort during the procedure. Thanks for watching. If you have any questions or comments, please leave them below. And don't forget to subscribe to our channel for more videos on anesthesia and critical care. Thanks for watching.